My friends, this is Dr. B, the best doctor in medicine. 30 plus years of clinical experience in medicine. Today I want to talk to you about why a lot of my patients, older retired patients, right, are not happy. A lot of my patients are not happy. I would put that number at around 20%. 20%, about, plus or minus a few percent, of my patients are just not happy. And I'm talking about the older population, the retired population. I work in a beautiful cardiovascular clinic in Mountain View, California, the beautiful but expensive city of Mountain View, California. And we do cardiovascular medicine. We specialize in diseases of the heart, in diseases of the blood vessels, in diseases of the cardiovascular system. And I can estimate that about 20% of my retired patients who come to see me, because I'm a cardiac imaging specialist, I check their heart, right? So that the cardiologist can treat their disease, their cardiac illness. About 20% of them are not happy. They suffer from just unhappiness or depression or anxiety or nervousness or sleeplessness. And they have this overall, I can see it, I can feel it, the way I talk to them, the way they talk to me. I can see it, and I feel very sad to notice this unhappiness, lack of happiness in about 20% of retired people. When you retire, you are supposed to be happy, because that's the last journey of your life, the last 30, 35, 20, 25 years of your life before you die. So you're supposed to be happy, to have a good time with family, friends, blah, blah, blah. Enjoy life, as they say, enjoy the retirement. But unfortunately, I can see it in their eyes, I can see it in their face, I can see it the way they talk, the way they respond to me, that they have unhappiness in their mind, unhappiness in their heart. And of course, I'm not a psychologist, I'm not a psychiatrist, but I've been in medicine for 30 years. I've seen hundreds of thousands of patients. And in 2 minutes, sitting down and talking to my patient, I can see who is happy, who is not happy. I can see who is enjoying life and who is not enjoying life. Even though I'm not a psychiatrist, I'm not a psychologist, I've had so much human interaction with my patients that I see very quickly this unhappiness in their eyes, in their voice, in the tone of their voice, and in their face. And in most of these patients, whether men and women, this unhappiness is multifactorial. There's many reasons why a retired person who should be happy is not happy. And the number one reason, because I talk to them, I try to dig deeper. You see, I'm one of the few people, few doctors, few healthcare professionals, whether nurse, chiropractor, dentist, physician, surgeon, blah, 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 medical assistant, nurse practitioner, who spends a lot of time inside the room with his patient, right, or her patient. I spent an hour in the exam room. Our receptionist knows that she has to schedule every hour one patient for me. I'm not in a rush like 99% of doctors to see the patient quickly, kick out the patient, make more money, see another patient, because I have to pay my Ferrari, my Lamborghini, my villa in Spain. I have to pay alimony to an ex-wife or to a girlfriend or blah, 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 right? So I am able because I decluttered my life. I simplified my life, because I don't own any mansions or Ferraris or Lamborghinis or apartment in Mexico, blah, blah. I just own one simple one-bedroom apartment, and I own one simple car called a Honda Accord, 10 years old, but give me good gas, beautiful, nice. I maintained it. It runs pretty good. That's the only thing I own. I don't have a wife. I don't have any kids to feed. No ex-wife, no kids that I don't know about, right? And right now, as of 4 years ago, I have no girlfriend. My God, what a blessing. My life is so simple, so humble. I live with modesty, humility, and especially I have the time to take care of myself, to go to the gym 2 hours a day, to sleep 9 hours a night, to study a lot, to learn about new medication, new techniques in surgery, new this, new that, right? I'll have the time to study, to upgrade my knowledge in medicine, in surgery, in advanced mathematics, physics, blah, 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 biology, biochemistry. I keep upgrading my knowledge constantly, despite being in medicine for the last 30 years and more than that, actually, right? So, a lot of these people are able to sit down in the exam room, me with Dr. B, and I talk to them. How are you, sir? This, that. How many kids you have? Blah, blah. Where you come from? One language you speak? Blah. What was your profession before you retired? So it's easy for me in a few seconds, 1 minute, to see the guy is not happy or the woman is not happy. And of course, I try to dig a little bit because I try to help. I want to see if their mental stress, their high cortisol stress level, right? Cortisol is a hormone of stress. If you are constantly stressed, your cortisol goes up, your immune system goes down, you increase the risk of dementia, you increase the risk of loneliness, you increase the risk of cancer because your immune system is no longer able to fight cancers, you increase the risk of infections. Any freaking virus, whether it's the COVID or the flu, you're going to catch it and get very sick because your immune system is weak. The mind interacts with the body interacts with the mind. If your mind is not healthy, your body will not be healthy. If your body is not healthy, your mind will not be healthy. So a lot of them are too sick. They have sicknesses, physical ailments, heart failure, kidney failure, liver disease, kidney disease, massive obesity, osteoarthritis, arthritis, many surgeries for this, many surgeries for that. And therefore, they are not enjoying their retirement, right? The retirement, in order to enjoy it, you need to be healthy, regardless of how much money you have in the bank. Remember, guys, that in America, 30% of retirees do not enjoy their retirement because they either lack health or they lack money or both. 30%, 1/3 of American retirees do not enjoy their retirement because they don't have enough money or they don't have good health or both. So these 20% of my patients that I see who come to check their heart, 20% of them, a lot of them are not healthy. And because they are not healthy, they cannot enjoy their retirement. And when I talk to them about their previous profession, a lot of them are former engineers, former lawyers, former tech workers, this, that, very bright people who obviously have had the time to save money. They do have a pension, blah, blah, blah. So they do have enough money in the bank, but they don't have enough health to enjoy it. Some of them are in wheelchair because of severe neurological disorder that keeps them from walking. A lot of them have heart failure. They cannot walk. They cannot run. They cannot bike. They cannot swim. They cannot go up and down the stairs. A lot of them have had heart attacks, heart cardiac surgeries, coronary bypass. A lot of them have had a lot of cancers, right? Remember, cancers, the risk of cancer increases if you have high blood pressure, diabetes, immunodepression, all these kind of diseases of the mind. If your immune system is depressed, suppressed, cancers grow. If you are constantly depressed, if you have constantly anxiety disorder, if you have constantly sleeplessness, your immune system becomes depressed, becomes low, inefficient, and can no longer protect you against cancers, can no longer protect you against infections. So it's kind of catch-29. One problem leads to another, another leads to this one, that one leads to that one. I mean, it's a disaster what people do to themselves. So you need, guys, to do everything you can to fight that high blood pressure, to make it normal, that diabetes. You need to shed a lot of pounds. You need to sleep at a regular basis, at a regular hour every night. You need to hit the gym. You need to zip your mouth and eat just like me, like Dr. B. I eat just a tiny bit, once or twice a day. The rest you do little snacks, right? Healthy little snacks of nuts, walnuts, 1 or 2 eggs, 1 avocado, olive oil, peanut butter, healthy stuff. And overall at night when you go to bed, you need to have eaten a little bit of calories only, just a few little calories. Altogether healthy food, but not too much of it, a little bit of healthy food, so that you have a low amount of calories. And then, like Dr. B, you need to go at night at the same time, every night at the same time. Train your brain to fall asleep at the same time. I go to bed every night at 9 o'clock. 9 o'clock, and my brain wakes me up automatically at 6 o'clock in the morning. I get my 9 hours of sleep. My brain is super sharp, extremely low risk of dementia. My memory is super sharp. My God, I'm super healthy. My tummy is flat like a board. I'm muscular. I have muscles. I go to the gym 2 hours a day. I have no fat. My carotid arteries, my aorta, no plaques at all, barely a tiny bit, and I'm 50 years young. I have no love handle. My butt is beautiful, all muscles, no freaking fat. And you can do it, and it's not too late. It is not too late to grab the bull by the horn and to start modifying, changing your life, so that you're not like the 20% of my patients who are just not happy when they are retired. And all of them, as I said, are educated people. And I can see that there's many different reasons, maybe grudges from ex-wife, ex-girlfriend, blah, blah, blah. But it's definitely not the money, because based on their profession, I can see that they must have enough money in the bank to be happy in their retirement. And it is, of course, the fact that they are sick, they are not healthy, they had surgeries before, cancer treatments, this, that, liver failure, kidney failure, and obesity, being overweight. A lot of them are overweight, a lot of them are also obese. And you don't have a high life expectancy when you are obese, when you are overweight, because being overweight or obese increases the risk of dementia, the risk of cancer, the risk of heart failure, liver failure, kidney failure, all sorts of cancers, right? Same thing for your immune system. Being obese decreases your immune system. You become immunodepressed. immunosuppressed. And then, of course, being immunosuppressed increases the risk of cancers and blah, 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 infections and blah, blah, blah. So you need to shed the pounds. You need to treat your high blood pressure, your diabetes, because high blood pressure and diabetes destroy your heart, destroy your kidneys, destroy your eyes, destroy your brain. You will develop dementia, right? So there's so much you can do, guys, to not be among the 30% of Americans who retire but are not enjoying their retirement because they either are not healthy enough or don't have money enough or both, right? And you have to do all this so that you don't become like 20% of my patients who are just not happy. They are not happy campers. I feel bad about it because they have all these diseases and blah, 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 and being overweight, diabetes, high blood pressure, heart failure. And a lot of it can be solved. And the number one is the diet. You need to go on diet, guys. You need to stop enjoying life. You're not enjoying life when you put food at the center of your life. Enjoying life is not about eating food constantly. That is not enjoying life. That is committing suicide. You see, food is in a little corner of my life. Food, I apologize, I look at the clock to not talk too much because I can talk for hours, to not just bother you too much for your time. But again, thank you for your viewership. Food is in a little corner of my life. Food is not the center of my universe. When you put food in the center of your universe and when you consider that food is a way to enjoy life, well, that was okay when you were young. But once you reach a certain age, like 40, 45, 50, 55, you need to just zip it, guys. And you have to do that even younger if you are already obese and overweight. Like half of the teenagers are either obese or overweight. Those people, they need to zip it. They need to hit the gym even more. So all this enjoyment of life, which is made of food, constantly food, sex, traveling. When you travel, people are not interested in the culture and the language of that country anymore. All they care about is taking stupid selfies of themselves. Oh, look at that. I'm over there. Oh, look at that. I'm taking a selfie in front of the freaking stupid Eiffel Tower. Oh, look at that. I'm in Milano, Italy. I'm taking a selfie in front of the Duomo and the Cathedral of Milano in this beautiful plaza over there. That's all they care about. And then they go to restaurants constantly eating. And they don't care about the language, the culture, and then by the time they come back from vacation after 1 or 2 or 3 weeks or 4 weeks vacation, they have gained 30 pounds. They are fatter than before, bigger than before, more heart attacks, more heart failure, more liver disease, more kidney disease, more fatty liver, right? More triple chin and everything. This is not enjoying life, right? This is a life of a dog. The life of a dog is constantly thinking about food, constantly sleeping, constantly having sex, and constantly having fun, right? The dog sleeps. After the dog wakes up, just thinks about eating, and then when going to go to the doggy park to have sex with the female dogs, and then go over all the male dogs, and then go to the park to play, right? Sleep, food, sex, and freaking fun. That's the life of a dog. But a lot of my patients and a lot of people, a lot of my family members, that's for them enjoying life. That is not enjoying life. That is committing suicide, because too much food, getting bigger and bigger and like that, and then high blood pressure, diabetes, and big belly like a 7-month pregnant woman or 9-month pregnant woman, right? This is not enjoying life. And then dementia comes and heart attack, heart failure, strokes and everything. It is never too late to address your issues. It is never too late to change course, to change direction. It is never too late to hit the gym, to zip your mouth, to shed pounds, to take your health seriously, to start sleeping every night at the same time, to go to the gym every day. It is never, ever, ever too late. It is never too late. I love you guys. Dr. B is here to help you. I'm not here to lecture you, to scold you. It's just that I feel bad. I feel empathy for all my retired patients who are not healthy, who are not happy, who are not enjoying their retirement. Do everything you can to not be among these people. I love you guys regardless of your color, your race, your ethnicity, your religion, whether you're a man, a woman, anything in between. I don't give a cat, so I love you regardless of everything that I said. I love you just because you're a human being. I give you a big hug. Put your comments, your questions down there. I will get back to you ASAP in my busy but beautiful life. Thank you so much for your viewership. Thank you so much. And God willing, I talk to you in the next video. Thank you very much. Bye-bye.